My name is Grace Masharia, the founder of SLT Support Therapy 360. I'm so proud to have this center because it's a vision that started some years back. You may wonder, what does SLT support mean? The first idea of starting this place is, as a speech and language therapist, I had a clinic where I only used to see patients with speech and language problems. And that's where the name came from. SLT stands for Speech and Language Therapy. But now notice it is SLT Support Therapy 360. Why? Because people who have speech and language problems don't only have that. They may need the support of other clinicians like physiotherapy, occupational therapist, counseling psychologist, dietitian, and all that. This place we have put it in such a way that you can access therapy 360 is a one-stop shop. Being a speech and language therapist, I've worked with patients who have had communication problems and feeding and swallowing problems. But one of the biggest challenges that I had was where I needed support from other professionals like physiotherapists and occupational therapists, and I would find that I would have to postpone something I needed to work with because of the support I would like to get from my clinician. And I came up with an idea of coming up with a therapy space, a neuro rehabilitation center, where we can have one space where when we get a patient who comes in, can be seen by all the different professionals. They can be seen by a physiotherapist for their mobility. They can be seen by occupational therapists for their activities of daily living, as well as adjustment of their space, their living space, as well as being seen by a speech and language therapist for communication. And that's where the idea of this place came up. Our vision is actually we are dedicated to transforming lives through holistic care and empowerment. We envision a future where every individual of all ages and background will be able to live to their fullest potential through the care we have given them. And our mission is to provide passionate and comprehensive care that is diverse and to the needs of individuals across their lifespan. For example, as a speech and language therapist, I work with children after they are born, especially premature babies who have feeding problems. So you can imagine if we can start providing care from the time a baby is born, that means we are able to identify their problems. We are able to give therapy so that they can grow to their fullest potential. I happen to have gone to India in a therapy center, and their care is started from NICU, neonatal ICU. So babies who are premature are seen by occupational therapists, physiotherapists, as well as speech therapists from NICU, all the way until by the time they are turning 3, they have ability to communicate, they have ability to feed themselves, and they can be able to do activities of daily living, and they are meeting their milestones in time. And the purpose of doing this is also to reduce the cost of care, because when patients are seen individually by different clinicians, it means that they have to pay for every service differently. So our vision is hoping that we're going to be able to reduce the cost of care, so that at least we get a package where if you need to be seen by a physiotherapist, an occupational therapist, and speech therapist, as well as guidance and counseling, because most patients we see, they need counseling, guidance and counseling to be able to go through what they're going through, as well as their caregivers and family. So we are envisioning that we can be able to have where we don't have to go all over the place looking for therapy. At SLT Support, we have various services that we provide. We have physiotherapy services, occupational therapy, as well as guidance and counseling. And in collaboration with the doctors, as well as dietitian, you can get dietitian review and recommendation. And speech therapists, we not only deal with just talking and stammering, but we also deal with swallowing disorders. I personally specialize in swallowing disorders all the way from from children who are very young. Children, if your baby has a problem with transitioning from liquid diet to solid diet, I specialize in doing rehabilitation for that, as well as when our older parents or geriatrics, people who have feeding problems, like people with dementia, you notice that they struggle with feeding. Others who have neurological disorders like Parkinson and ALS, you'll notice that they start choking when they're feeding. So we do assessment as well as plan for their care, and we also do rehabilitation so that they can be able to feed safely. So sometimes we take it for granted that eating is just taking a spoon and plate of food and you start eating. But you notice that there are some people who struggle taking liquids, who struggle taking solid food, and who we do rehabilitation for that. We also work in collaboration with hospitals, so we also work with people with tracheostomy who have tracheostomy in terms of planning for their rehabilitation in terms of communication as well as in terms of feeding disorders. We believe that this is the place where your path to recovery starts. As a speech and language therapist, there are many things that I do. One thing that is actually very dear to my heart is feeding disorders. Are you a mother with a child with cerebral palsy who you're struggling to feed your child, and most likely you've been going to hospital frequently because your child has a chest infection, and most probably you've been thinking they're having a cold? Maybe that is not the case. It could be there's some little food that is going into their lungs. And if that happens, that is what doctors, when you go to hospital, you hear that your child has gotten pneumonia. This kind of pneumonia is different from the kind of pneumonia you get because you felt cold or you've had a chest infection. It is called aspiration pneumonia. And aspiration pneumonia is preventable. If you come to us, we'll teach you how to position your child to be able to feed your child so that your child can feed safely. A lot of children who have cerebral palsy, usually who have drooling, most likely when you put food in their mouth, it comes out. So you are likely to put the head up so that the food does not come up. Did you know that when you tilt your chin up, you have opened the airway? It is very risky. Food will go straight to the lungs. So what we do, you make sure that your child's head is in neutral position. Support your child and support their mouth so that when you put food, close their mouth gently so that the food does not come out and it is safe for them to feed. If you don't believe me, I would like you to do one thing. Open your mouth slightly, don't close your mouth, and swallow. You'll notice that you'll not be able to swallow. That's what happens to children who cannot close their mouth. So they just need a little bit of assistance. So call us if you need help. Do you have somebody who is elderly in your home who is struggling to feed? Most probably they have dementia or have a neurological problem. May it be stroke or may it be Parkinson, and they're struggling to feed. Either you notice that they're losing food as they're chewing, there's loss of food, they're drooling, or they're struggling, they're coughing when they're drinking water. That is a problem that is caused by neurological problems, and that is something that can be sorted by a speech and language therapist. I love making sure that I keep people out of hospital by providing therapy. So if you have a parent or a grandmother or a grandfather who is struggling with and having frequent chest infection, please give us a call. SLT Support Therapy 360, we can be your solution. Bring them so that we can review them and then we can give you advice how to modify their diet, or even what we can do so that they can continue feeding safely and you keep them out of hospital. We don't want them getting aspiration pneumonias. You can visit our website and so that you can see the kind of services we provide and social media handles that will be displayed. And you can book appointment either through our website or you can call number 0799 750 749, and we believe that your path to recovery starts here. So give us a call.